my name is Meg. I am going to be performing this musculoskeletal assessment on Jim. Jim, do you give me permission to perform the assessment and record it for the class?
Sure.
Okay. So first, when we do this, I'm going to assess the range of motion of his neck. So I'm going to have you put your chin to your chest. Perfect. And I'm going to have you look up towards the ceiling. Flex it up. Perfect. And you can turn your head side to side now. Perfect. And you want to make sure that the patient doesn't have any tenderness or pain when they're doing that. And that didn't look painful for you.
It was not.
Okay. So now we're going to do some range of motions with his shoulders. So first I'm going to have you raise your hand up. Now I'm going to have you raise your hand to the side. Perfect. And can you raise it out behind you? Perfect. Okay. And now I'm going to have you touch your other shoulder blade. Over behind. Yep. And then I'm going to have you raise your arm, at shoulder height, like your arm there. Perfect. And that was normal. As you can probably see, he has full range of motion of his shoulder. So now I'm going to check the range of motion of his elbow. So I'm going to have you flex your elbow and raise it. Okay, good. And then I'm going to have you, can you do it outward a little bit? Perfect. Okay. So now I'm going to move on to examining his hands and his wrists. So, Jim, the first thing I'm going to have you do is perfect. So he's raising it palms up, and I'm going to have you bring them up and down, and then go down, and go up. Perfect. And now I'm going to have you go back here with your hands facing up. Perfect. And I'm going to have you go out. Can you go up? Perfect. You can go inward. Awesome. So now I'm going to be examining the range of motion of his hips. So in order to do that, I have to have you lay down. So I'm going to first put my arm under the bottom of his back, and I'm going to bring this in. And now I'm going to have you extend it outward. Perfect. And you go back in and go out. Okay. So he's a little stiff here, but it's a normal exam, and I'm going to have you straighten your leg. I'm going to have you go out towards me and then in towards you. Good. So he has full range of motion of his hip. Now I'm going to have you sit on back up. I'm going to now begin examining Jim's knees. So I'm going to have you go forward and now flex back. Perfect. And now can you go out with your knee and in? So yeah, and you want to support, depending on the client's range of motion, you might have to support them with the knees, especially that's kind of a sensitive joint as we age. As I'm doing this, I'm assessing the skin in each area for the characteristics, the hair distribution, the warmth, the color, the tone of the skin, any abnormal marks or lesions. None are seen on this exam. I'm going to now move down, and I'm going to check the range of motion of his feet. Hang on one second. Perfect. Sorry. I'm going to have you point and flex your feet. Point and flex. Perfect. And that's checking his ankles. Now I'm going to have you go outward and inward. Good. So he has full range of motion of his ankles. I'm going to have you now stand up, and I'm going to check the range of motion of his spine. I'm going to raise this up a little bit. Now, can you go forward like I'm doing a scoliosis test? So basically, I'm going to be checking to make sure everything is straight and in line. I'm going to have you go up a little bit again. And in a patient with scoliosis, the shoulders might be uneven. There might be noted curvature of the spine. Everything looks good here. Now, Jim, I'm going to have you face the camera. I'm going to have you bend to the left a little bit. Good job. Now, can you bend backwards? Good job. All right. So he has full range of motion in his spine. So at this point, this would be considered a normal musculoskeletal exam.